everyone, this is Dr. Morgana Colombo, board-certified dermatologist, and I am here to educate you and tell you how it is. Have you been told that sagging is an unavoidable part of aging? If you've been told that, you've been lied to. You can totally tighten, lift, and improve your jawline with a few simple measures. But the key to that is to do it early on in your 40s and 50s before it's too late. A lot of women wait until they're in their 60s, but by then they've lost like 40% of their collagen. So it's tougher to turn back the clock at that point. So the key to improving your jawline and decreasing sagginess is to act early. If you wait, gravity wins. So act quickly if you don't want to lose that battle. There are a few things that can be very helpful to doing that, and I'm going to explain that to you. So, I'm in my 40s, I'm 46. A few years back, I was like, oh my God, I've noticed a little bit of beginning of this jowling. What can I do? I was like, I need to do something about it now, because I know if I wait, I'm going to be in the same situation as a lot of people I've seen in the past, where they're sort of stuck with a surgical option, and I did not want to go surgical. So I'm a dermatologist, access to a few tools in my little box, at work. So, I acted on it, and, I got a little bit of improvement. I'm pretty satisfied with, my jawline at 46. But what did I do, and what can you do to improve your jawline and not be stuck with a saggy jawline, except for, going surgical? Number one, the key to a tight jawline is to strengthen your scaffold. What I mean, strengthen the scaffold, what is that? So your scaffold is basically composed of collagen and elastin. Those are molecules that make up the extracellular matrix, fancy word, of your dermis, which is basically this backbone of your skin, what keeps the whole structure together. If you lose your collagen and elastin, the skin just collapses, it gets saggy. So you need to strengthen that. And guys, how do you do that? There are actually lots of things you can do to promote collagen and elastin, and as a consequence of that, tighten your skin. Number one, skincare. There are a few ingredients that are really critical and you need to have on your skincare routine if you want to promote collagen. Retinol, peptides, growth factors, vitamin C. Think about those ingredients in your skincare if you want to promote collagen. And the other ingredient is sunscreen to decrease degradation of collagen that happens from sun exposure and free radical exposure. So sunscreen, critical. You have to be religious about it. Listen to me. Number one easiest thing you can do to protect your skin and keep your scaffold from degrading. So skincare. If you need some help with products that have those ingredients, check out our Vivoderma skincare line. It's aimed at perimenopause and postmenopausal skin and promoting collagen. So it has all these ingredients that you need. How else can you promote collagen? So there's skincare, but there are also procedures that you can do in a dermatology office and will promote collagen. A lot of those procedures are heat-based, but recently we also have some new procedures that are kind of micro-coring or micro-cutting based. The heat-based procedures are radiofrequency microneedling. You insert needles into the skin, and the needles have the heat in them, and they basically insert heat into the skin, and that heat promotes collagen and elastin. Be careful with that, because if you insert it for too long and too deep, you will melt fat, and you don't want to lose your fat, because if you don't have fat to support your skin, it's going to sag even more. So you have to go to a properly trained person to do that treatment, and preferably a physician that can really properly do that for you. So RF microneedling is an option. You can also deliver heat through an ultrasound machine called Ultherapy. It will deliver heat superficial and deep into the skin. The superficial heat into the dermis promotes collagen and tightens the skin. Then deep heat is interesting because it goes below the skin into this layer, fibrous tissue layer called SMAS that connects the muscles to the skin, to the dermis. And that layer gets loose over time. So this treatment can tighten it up and give you like a slight lift from inside your skin. So, different mechanisms that also can really help your jawline. I myself am a huge fan of Volt therapy. I've been doing it yearly for the last, I think, 3-4 years. And I think it's really helpful, especially really helpful if you're in your 40s and 50s. Again, early in that process, guys, early is key. There are also lasers that can deliver heat and tighten up your skin, fractional CO2, fractional erbium, so those are all good options. The one that has no downtime is Volt therapy. The other ones have a little downtime. They all work, and if you combine them, you get even better results. I also talked about the other technique of inducing collagen on the skin, which is microcoring. So you do little tiny punches or cuts on the skin. You remove little pieces of skin. So, of course, you get a little tightening by recutting skin, but you also promote a lot of collagen with the inflammation related to the microcoring. The one machine that is sort of famous for that is Ellacor. Great for tightening your jawline. It's like microneedling on steroids, actually. If you're in your 40s, 50s, and you do Ellacor, you really get amazing tightening results, almost getting you close to a surgical result, but not quite, but really amazing technology. So we talked about creams and procedures that can tighten up the skin, promote collagen. But, the jawline is not just skin. You have structures underneath it. You have your fat, bones, muscle. So you gotta keep it all together and healthy. So for muscle contraction and tightening, there is a treatment called EM phase. It basically creates this electrical signals into the muscle that contracts it several times, and that leads to tightening and a lifting effect on the skin. The only downside is that you have to keep repeating it, just like exercising. If you don't do it multiple times, you just lose the effect. So, but another option of a way to kind of like work your muscles, muscle exercises, that's a little controversial. I'm kind of like not 100% convinced that they do give you any real benefit, but they're not going to harm you. So if you want to try those, muscle yoga kind of like movements, okay to try. We talked about muscle, skin, and then what about the bone and fat? So as you age, you lose a little bit of like that bone. A lot of people lose fat. And then the other thing, the interesting thing that happens with fat is it moves. It moves from the top to the bottom of your face. So a lot of people get like deposition of fat in the lower face, and that will give them that jowl appearance. So what can you do with that? One easy thing to consider and try is this injectable called Kybella, deoxycholine. It basically melts fat permanently. You inject into the jaw, get rid of the little, fat that moved from up there, and it improves your jawline. But of course, you have to be careful so you don't hit nerves. So you have to go to a proper provider to do that. Specifically, dermatologist or plastic surgeon. There are, RF microneedling devices that can get the needles really deep into the fat and melt some of that fat too. So that's another option. And of course, you can do like a mild liposuction procedure to kind of get rid of that little extra fat there, which drags down your jawline, creating jowls and saggy jawline. I also talked about fat loss. So if you don't have any fat on your lower face, the skin has nothing to hold on to, and what happens is sags. So to create a little bit of volume, you have your volumizers, aka fillers, and the biostimulators. So the regular fillers that we use are the hyaluronic acid-based fillers, which they're great. You can put a little bit on the lower face, jawline, and they will give more hold to your skin. In the jawline, you want to do tough, robust filler. Volux is a very good one in the hyaluronic family. Aside from hyaluronic fillers, you also have your biostimulators, Radius and Sculptra. They are injected into the skin. Radius is great. It has like an immediate volumizing effect, but it also promotes collagen over time. So it regenerates your skin in a way, and it's sort of really thick, so it can almost mimic bone and recreate like a really nice jawline for you. If you hyperdilute it, you get more natural kind of like volumizing, collagen promoting effect. I have it on a patient. She is like in her 80s and she's been doing radius for 20 years and she looks like extremely young. It's like she's like the youngest looking 85-year-old that you ever see. So I have a thing that I think radius definitely can help so much in the aging process by regenerating collagen. And who knows, other tissues there too, probably. The other one, there's a biostimulator, Sculptra. That's polylactic acid. It doesn't have the immediate volumizing effect the Radius does. It has like sort of like this delayed effect after collagen is promoted. So, but another good option if your lower face is very wasted and you don't have any volume there and you need that volume to hold your skin. So all good options, going hyaluronic or, with the biostimulators. I tend to favor the biostimulators because of the collagen promoting effect of them. And they just look really natural and good and make the skin look glowy. The one biostimulator Sculptra actually has like an FDA approval for glow, such a subjective thing, but it really does help to make your skin look better and glowier because of that collagen promotion effect that it has. So like we talked about, in order to have a tight jawline and decrease sagginess, you have to work on the scaffold of the skin, aka collagen. We talked about products that can do that. We talked about procedures that can promote collagen in the skin. But you also need to work on your muscles, fat, and bone. And we talked about, volumizers, fat removal devices that can, or fat, or non-fat necessarily, but volume promoting, treatments that can help. So there are lots of things you can do to improve your jawline. And then from here. And then lastly, I'll mention that the jawline is very much related to your neck. The neck is connected to the jaw. There is this large muscle, platysma, that attaches to the jaw. So as you get older, it contracts. You form bands called platysmal bands, vertical bands that you see on people. And those bands really pull down on your jaw and create a way saggier jawline. So one easy thing to do to improve your jawline is to inject some Botox or neurotoxin into those bands to relax them so they don't pull on your jawline so much. So that's the last thing I'll mention. But as you can see, there's so many things you can do, and they do work, guys. They work. But the key is you have to do them when you're younger, 40s, 50s, before your sagginess is very significant. You can still do it when you're older, but you won't have as good result. So if you want to delay that facelift, the neck lift, please get on top of your neck and jawline when you're young, in your 40s and 50s. You can definitely improve it. I promise. Technology is there to help you.